The next topic in GIT chapter is diarrhea. Diarrhea is basically defined as a passage of 3 or more loose or liquid stool per day. Frequent passing of formed stool is not considered diarrhea. There are different causes of diarrhea, that is, multiple cause including bacteria from the contaminated food, water, viruses such as influenza or rotavirus, parasites found in the contaminated food and water can result diarrhea. Certain medications, for example, antibiotic, anti-cancer, they can also result in diarrhea. And antacids, for example, magnesium hydroxide, food intolerance and sensitivities, certain diseases of the colon such as irritable bowel syndrome or Crohn's disease can also result in diarrhea. The most severe threat which is posed by the diarrhea is dehydration caused by loss of water and electrolytes. Diarrheal diseases is the leading cause of death in the children throughout the world due to dehydration. Elderly are also at the same risk. When severe diarrhea occurs, assessment for dehydration and electrolyte imbalance receive top priority, and rehydration with oral rehydration solution or IV fluid may be required. Now come to antidiarrheal drugs or agent used safely in the patient with mild, moderate, and acute diarrhea. These agents should not be used in patients with bloody diarrhea, high fever, or systemic toxicity because of the risk of worsening the underlying condition. Antidiarrheal are also used to control chronic diarrhea caused by such condition as IBS and IBD. The different books classify antidiarrheal drug by the different way. Mostly the classification which is accepted on the basis of mechanism of action, they are classified into 3 main classes. First class is antimotillity agent, second is adsorbent, and third antidiarrheal class is agent that modify fluid and electrolyte transport. We can also classify the chemicals which are used as an antidiarrheal on the basis of their chemical nature. For example, opioid agonists, bismuth colloides, bile salts and binding resins, OCTREOTIDES, probiotics, and antibiotics. In opioid agonists, the most common drug which is used as an choice of medication as an antidiarrheal is LOPERAMIDE, comes with the name of Imodium, diphenoxylate plus atropine, which comes with the name of Lomotil. This is a combination medication, and in the same class another agent is iluxadolin. Bismuth colloides are the same which has been used in peptic ulcer as an bismuth subsalicylate and bismuth citrate potassium. Bile salts and binding resin include those which are involved as lipid lowering agent, for example cholestyramine, cholestyramine, and cholecystyrene. Octreotide includes somatostatin, which resembling the natural hormone which is liberated in the GI tract. It is the same somatostatin which acts on the receptors which are present in the GI tract. Probiotics is a new class of drug, and these are basically the dead or minorly dead or partially dead microbes which comes in the preparation as inflor, biflor, and enterogermina. Antibiotics are, although not the antidiarrheal drug, they are basically given if the diarrhea is associated with any contamination that is affecting the GIT mortality. Most commonly used antibiotics for the control of diarrhea, including azithromycin and fluoroquinolone. Now, one by one, we will discuss about the agents on the basis of their chemical nature. I'm starting with the opioid agonist. They can also be acting on the basis of mechanism as an anti-motility agent. There are two different classes which are acting on the motility of the GI tract. One is the anticholinergic, and the second one is the opiate-like medication. They act by slowing peristalsis by inhibiting presynaptic cholinergic nerve in the submucosal and myenteric plexus and lead to increased clonic transit time as well as fecal water absorption, so it can minimize the diarrheal symptom, that is excessive loss of fluid as well as electrolyte from the fecal route. The potential for addiction limits the usefulness of most of the opioid agonists. Loperamide Imodium is a non-prescription and it does not cross the blood-brain barrier, so it is not the analgesic drug and have poor potential for addiction. Tolerance may not be reported, and the dose which is required for the treatment of diarrhea is usually 2 mg 1 to 4 times per day. Another agent in this class is the diphenoxylate, which is a prescription medication but non-analgesic in standard doses, while at the higher doses have central nervous system effect and prolonged use can cause opioid dependence. Commercial preparation contain a small amount of atropine to minimize the overdose. So 2.5 milligram diphenoxylate usually come with 0.25 milligram, 0.025 milligram of atropine. So this combination will minimize its central nervous system effect and minimize its dose. Aloxadoline, it is again another opioid agonist, which is a prescription opioid and high affinity for the mu receptor. It is given orally and it binds to the gut opioid receptor, resulting is in slower clonic transient and increased fecal fluid absorption. It is approved for the treatment of patients with diarrhea, which predominantly occur due to the inflammatory bowel diseases, at the doses of 75 to 100 milligram 2 times per day. A very serious effect which is associated with the loperamide. Loperamide should not be given to the young children than 2 years of age because of the risk of serious breathing and heart problem. Taking more than the prescribed dose can cause serious abnormal heart rhythm and that can lead to cause death. Read the drug label carefully for information about interaction with other medication, specifically antiarrhythmic and antipsychotic. Bismuth colloidal adsorbent. Bismuth colloidals are acting by mechanism of adsorption. Bismuth colloid adsorbent, they are acting as an adsorbing agent. Adsorption is the adhesion of molecule to a surface work by coating the wall of the GI tract and binding the causative bacteria or toxin for elimination from the GI tract through the stool. Bismuth subsalicylate, which is available as a brand Copactate, reduces stool frequency and liquidity in acute infections diarrhea. Due to salicylate inhibition of the intestinal prostaglandin and chloride secretion. Bismuth has direct antimicrobial effect and bind antirotoxin, accounting for its benefit in preventing and treating traveler's diarrhea. It is available in tablet and suspension. 2 tablets, 2 tablespoons every 1 to 2 hours is the recommended dose. but due to its adsorption activity, it has interaction with many drugs by decreasing their absorption. Pepto-Bismol, it should be avoided if the patient has an allergy to salicylate, or if the patient is taking other salicylate products such as aspirin. It should not be used if the patient has an ulcer, bleeding problem, or bloody or black stool. Children and teenagers who have or are recovering from chickenpox or flu-like symptoms should not use this product. When using this product, its change in behavior with nausea and vomiting occur. Consult a doctor immediately because these symptoms could be an early sign of Ray's syndrome, a rare but serious illness. The third compound and third agent, which is acting as an antidiarrheal agent, it is bile salt binding resin. As told earlier, that is cholestyramine, cholesterol, and colcivilam, a lipid lowering agent. They bind with the bile salt. Disease of the terminal ileum or surgical resection lead to malabsorption of bile salt, which may cause clonal secretory diarrhea, decreased diarrhea caused by excess fecal bile acid. The most common adverse effect due to the use of bile salt and binding resin is the bloating, flatulence, constipation, and fecal impaction. Further removal of bile acid may lead to cause exacerbation of fat malabsorption. Cholestyramine, cholesterol bind with the number of drug and reduce their absorption, while colicivilam having limited drug-drug interaction. OCTREOTIDE, which are somatostatin, a key regulatory peptide released in the GIT and pancreas, D cells, and enteric nervous, as well as from the hypothalamus, decreases release of certain hormones. It reduces intestinal fluid secretion, slow down motility of GIT and gallbladder, but having short half-life of 3 minutes after injection. It is a synthetic octreopeptide with action similar to somatostatin. By IV, it has half-life 1.5 hour, administered by subcutaneous injection, resulting in a 6 to 12-hour duration of action. A longer action in the formulation are also available for once monthly depot transmuscular or intramuscular injection. Probiotics help replenish normal bacterial flora in the GI tract. Their side effects are limited, but only gas and bloating. But they are considered as the safest drug for the children as well as for the elderly. They come into different form like yogurt, powder, biflor and flor, and liquid form Antidiarrheal, and used for the prevention as well as for the treatment of diarrhea. Antibiotics should be used to treat severe traveler's diarrhea. Azithromycin is preferred to treat severe diarrhea, while fluoroquinolone may also be used to treat diarrhea, non-dysenteric, while another agent, that is rifaximin, may be used to treat non-dysenteric traveler's diarrhea. So this is all about antidiarrheal medication. Thank you so much.